When we're thinking about evaluating cannabis policy regimes, we need to think about how we can improve the current data systems, and then also we need to think about, well, what other types of data are now going to be available as we create this new industry. And so John's going to spend time talking about the new and exciting data sets. But with respect to what we're collecting now, each year we have the NISDA survey, where we survey 70,000 people, ask them about a lot of different behaviors. It's the primary data system that's used for cannabis policy evaluations in the United States. The last time I think we validated the results in terms of figuring out whether or not people were actually honest about what they were consuming was 2001. And this isn't just an academic exercise. It's really important for us to have a general idea about how much people are lying or misreporting or underreporting in these systems. You know, for example, when you're trying to figure out the size of a market in a particular state so you can make decisions about the number of stores to allow or try to make accurate projections about tax revenues, you need to know, should I multiply that estimate by 1.25 or 2? This is important. As I said, the best information we have is from about 15 years ago. And also, getting information about the validity of these surveys is really important for program evaluations. Because as we begin to look at what's happening in these different states, you know, if we do begin to see an increase in consumption, it's going to be hard for us to figure out whether or not that's actually a real increase, or it's just the fact that people are more likely to be honest about the reporting because there's less stigma. So one might think we might want to start doing this by state as well. But this isn't something we have to do every year. But I think if we're going to be spending tens of millions of dollars each year doing these surveys, I think it makes sense every 5 years to put a couple $1 million into validation. Second point I want to make is with respect to quantity consumed. Most of these surveys only ask about whether or not you've used in the past year or the past 30 days. If you're lucky, you'll get a survey which may ask about how many days you used in the past 30. But for doing the policy evaluations that we're interested in, and especially looking at some of the potential health costs or the health benefits of cannabis policy changes, we'd want to have better information about quantities consumed, how much people are consuming per use day. In fact, we confronted this when we were doing some work for the state of Washington and trying to help them figure out the size of their markets. You know, from the national surveys, we could try to get information about total use days, but we ended up having to create these web surveys with pictures of unrolled joints, trying to help people beginning to understand, you know, saying, hey, this is 1 gram of marijuana. On a typical day, do you consume exactly this amount, half this amount? And, you know, and the study that we did has been replicated in other states, but this was fairly ad hoc, and it wasn't subject to the psychometric measures or validation that you would want from these types of surveys. So I think it's really important that we get this information about quantity consumed for helping with the policy evaluations, but it's also going to be very important for when we're calculating the price elasticity of demand, which is very important for making projections about what's going to happen. We've got a lot of studies which focus on the participation elasticity. That is, as there's a change in price, what happens to the prevalence or the probability that somebody uses. But we need to know, given that there's been a price change, how does it influence the amount that people are consuming? And we're not going to be able to have that information unless we start asking better questions about quantity consumed. And the final point I want to make is about the products that people are consuming. For those in California and Washington and Colorado and Oregon who have, you know, for those of you who have been into these stores, you see it's a lot more than flower. Yet our surveys typically just ask, have you used marijuana or hashish in the past 30 days? It's time we make these changes because right now our data infrastructure just isn't set up to do the policy evaluations we need.
Is this on? Yeah, okay. I'm going to leave aside everything on the medical side. I really don't know anything about that and focus on the social science side. Historically, most of the marijuana-related research on the social science side has flowed in some sense from sociology, criminology, economics of crime, has been grounded in surveys and other sorts of instruments that produce data on an annual basis. I think what we need to do is fire all of us who come at it from that perspective, go to the business schools and ask them how they study any other legal industry because they have entirely different paradigms of data collection. After legalization, there will be enormous administrative data sets that should be mined that will provide much higher frequency data on sales volume than you could ever get from an annual survey. When you partner with the big companies that are selling this, you can get their loyalty card data. So the marijuana consumers are going to be in frequent buyer clubs, and you'll be able to have data on how individuals with known demographics have been purchasing over time the full variety of products at a level of detail that nobody would ever be able to give in a survey. Importantly, for even answering questions like elasticity of demand, which, by the way, the companies care about also, you would like to do the sort of A/B testing that Google does on us all the time. So whichever companies are selling via web interfaces will be able to present experiments made all the time about, we'll show this web page versus that web page, this set of prices versus that price, and we'll be able to learn a lot about elasticity of demand. I think there will also be lots of opportunities for scraping the web, the social media web, using natural language processing and text mining data to understand social interactions and dynamics in ways that haven't been used in the past. And if you really open up your minds and think about the Internet of Things potential, you can imagine the companies wanting to put out their vape pens that are GPS enabled that record every time a puff is taken, so that you get not just high frequency purchase data, but you literally know what street corner somebody was on each time they took a single dose. There will be a different degree of data available precisely because it's legal. In some respects, I suspect many of us in this room are not used to thinking about those units of analysis and those modes of investigation. And so I mean fairly seriously that we ought to invite B-school folks who are used to studying consumer goods of other sorts to the table, because they have a lot of methods that can complement the ones that we've been using historically.
I think the research of the future is going to be going a couple different directions, building on what's already been said. One is that we aren't going to be talking about marijuana liberalization policy as a bucket, one big bucket. Decriminalization wasn't one big bucket. Medical marijuana is not one big bucket. And legalization will not be one big bucket, especially when you look outside of the United States. So it's my hope that attention will be given to the different varieties and how different policies by themselves may be structured in such a way so that harms get reduced, benefits get maximized, harms get maximized, benefits get minimized. People pay attention to that, and I think data systems are developing along those dimensions already. Here in the United States, there's the Law Atlas group that has information on medical marijuana laws down to the product safety level, where they're talking about what in the state statutes are requiring testing and what are they testing for, labeling, and that. That level of information wasn't part of the debate about different types of policies 15 years ago, but that's the level of information now that more state agencies are becoming involved. That's in there in the U.S. policy. It's certainly in there in many of the other countries' policies that I hope will be used to better inform our knowledge about policy, so we don't talk about marijuana policy as if it's all one big bucket. Similarly, I'd like us to go beyond thinking about products, not just on what gets sold, but about what gets consumed. We need to understand what a dose is. The future of research in looking at harms is going to be looking for dose-response relationships. We don't have a dose. Use in the past 30 days is not a dose. We need to understand what a dose is in a single-use episode. How many episodes happen in a day? And what do we expect in that dose? And by dose, I don't mean how much marijuana is enrolled in your joint. That's not a dose. It's the cannabinoids in that joint. And with legalization in the states that we have, with the seed-to-sale systems that we have, we'll have a lot more knowledge about what these doses look like. We still don't know about how frequently they get used or titration. Those will hopefully be research agendas going forward. But that information is what we need to be able to understand relationships, whether cannabis is a good or a bad in terms of dose-response relationships for driving under the influence, in terms of health implications, in terms of use with other substances. So I see those as two big major focuses for research in the future.
I have two themes to take up. One is the value of master's students in need of thesis topics in fields that encourage ethnography. And there are a number of fields that do that. And sending them out to actually understand how cannabis is used. I had a bunch of students in a class who their task was to interview 3 marijuana users and sort of get a history of their marijuana use. It was just fascinating what was the variety of ways in which they took it, and sort of unexpected. We understand little about the process and how it's going to change under legalization, the process by which people decide what to take and how much to take. And that will clearly change with legalization. And, you know, they're really nice papers to be written if you've got the right set of students to do that. So I think it's a win-win. That is, we get something useful and they do something that they'll actually think interesting. Which isn't always the case. The second, I wanted to say just one word, plastics, but I couldn't do that. It was, I have 2 words, synthetic cannabinoids. In this country, at one stage, Monitoring the Future reported past year prevalence, I think, of as high as 10% for high school seniors. It was the drug with the second highest prevalence in that year. That figure has already started to decline, but nonetheless, synthetic cannabinoids probably are a serious public health threat. And I'm informed by people who are closer to the users than I am that nobody uses a synthetic cannabinoid if they can get good weed instead. And it may well be that even though this is heavily a youth market and not in principle covered by legalization, we expect there to be considerable leakage and more and higher availability of decent quality marijuana with a legal regime. And so I think a really interesting piece of research is to see what effect legalization has on the spread of synthetic cannabinoids. As I said, is sort of a second order, but not third order research issue, I think, for marijuana legalization. Thank you.
Thank you. So we got one question, and that's all we're going to have time for. So I'm going to grab it. And the question is, what one fact discoverable through research would most help us refine policies? What one fact discoverable through research would most help us define good policies? And I would give an answer that's somewhat different from the ones we've heard so far, which is more knowledge of subjective effects. We need to know in some detail what profile of cannabinoids in what user produces what kind of subjective effect, under what circumstance, both in the short term and the long term. We need diary data. We need the kind of stuff that Kleiman did. Basically, every 15 minutes somebody gets pinged, how happy are you? Be interesting to know whether people who smoke pot on average report themselves happier when they're smoking pot than when they're not smoking pot, and how that average happiness changes with years of cannabis use. This isn't business research, it's not medical research, but it seems to me it's mostly what we really need to know. I'm sure there are more questions. There are certainly more research topics we could name, but there isn't more time. So we come to our closing, and now I'm going to do something very dangerous. Some of you have noticed, some of you have mentioned to me that this conference is run unusually smoothly, and that seems to me consistent with my experience. And that's due to a crowd of people who have made this happen. I particularly want to mention my Beautech colleagues. Everything that happens at Beautech is due to Brad Rowe, and he's been sweating this for several months now. Bridget Fiore has been sweating it harder than anybody else. Lowry Heisler, Nathan Ladonovich have all just put hours and tears into making this happen. My colleagues at Marron have done a tremendous job in helping us out. Bob Jesse flew all the way across the country to do the final production. We've had help from Mark Blackbird and Shelley O'Neill, who came in as our event producers. And I have to mention the conference committee, which a number of you were on, but I particularly want to pick out John Walsh as having really worked extremely hard to make things happen. To City University of New York for providing us with this space, and it mostly worked pretty well. To Wayne Hall for filling in at the last minute in Tom Schelling's shoes, which is not a challenge that anybody wants to take on voluntarily. And all the speakers who contributed their time and effort to make this happen, and to all of you. I've been to a bunch of cannabis conferences. They tend to be fairly fraught events. And this one, I have to say, has been remarkably civilized. So thanks to all of you for participating in exactly the conversation that we hoped would happen when we came up with this idea 6 months ago. So just to close, I'd like to introduce the director of the Marron Institute, which is writing the check for this event, Paul Romer.
So my role here is to provide a kind of benediction, and I'm not usually asked to fill that role, so I reached back for some sacred text and came up with this from John Adams. Facts are stubborn things, and whatever may be our wishes, our inclinations, or the dictates of our passions, they cannot alter the state of facts and evidence. Now you can interpret that sentence the way he intended it when he was trying to persuade a jury to turn down their passions and look at the facts, and in the context of this discussion about the value of more evidence and the value of forums like this, fora like this, where people can talk about the facts and the evidence. But I think there's a nuance there that's quite important. The sentence, of course, denies what it says. It's trying to say facts really aren't very stubborn. They're typically overwhelmed by these emotions, and we have to try and protect the facts. So it's the facts that get kind of distorted and changed. But the truth is it goes the other way too. Our wishes, our inclinations, our passions can get changed too. Part of the debate about drug policy is about what we should think is right. And part of the difficulty in having this conversation is about some people who just want to know the facts, and some want to just directly try and change what people think is right. But at an even deeper level, our wishes, our inclinations, just at the level of, one more toke, should I smoke today, are dynamic. They're changing, and there are very powerful, interested actors who'd like to change those. And if we're a little bit more open-minded about the facts of our inclinations and wishes and passions, we have to recognize that the usual model that treats those as given is potentially very misleading, and a simple extension where your preferences, any individual's preferences, can change, and where individuals don't always know in advance how their preferences are going to change. In that kind of world, free choice can make some people worse off. So we have the usual kind of question about, well, efficiency. Does free choice lead to efficient outcomes? Even more troubling, this may have very specific implications for inequality. Some people who know less about how their preferences can be manipulated may be the ones who end up most disadvantaged in an environment where interested actors confronted with individuals who don't always know how this is going to play out, they could be the ones who end up being substantially worse off. So if I can kind of close with a pitch for the Mellon Institute. The reason we're so interested in practical policy questions, like what should we do about cannabis policy, is not just because these policy questions are important, both in this domain and in much broader domains about the real import of inequality, but we're interested in changing the basic science of the foundations of social science. And it's only when you take seriously a question like what to do about cannabis policy and take all of the facts seriously that you come to this more fundamental notion of what the facts are about those wishes, inclinations, and passions. So I look forward to the next update of this conference next year, and thank you all for coming.